Over 90% of those who die from suicide have a diagnosable mental illness. 100% of those cases could have been prevented if an individual reached the help they needed. Asking for help is one of the hardest things to do. Ultimately, it's the right choice. But have you ever wondered what happens after you ask for help? Well, there are a couple options: therapy, medication, and hospitalization. Let's start with therapy. A therapist normally has a comfy office where you can come a few times a week and sit down. A therapist allows you to express bottled up feelings in a comfortable manner. They offer support and advice in times of need. It is a safe space where you can work out any issues you feel need to be worked out. If you don't feel completely comfortable and honest with one therapist, find another. Different therapists have different ways of offering support, and it's important that you find one you're comfortable with. Therapists can also help identify any mental disorders you have and recommend a nurse practitioner for you to get medication. Nurse practitioners are normally the only ones who prescribe medication. Just as someone would take antibiotics if they got an infection, some people take medication for mental disorders. Medication aims at stabilizing neurotransmitters and other chemicals in the brain to help the individual. Medication is simply an external way to get the substances that other people normally make themselves. A nurse practitioner will help determine what medications you should take and at what dosage. Don't be afraid to tell your nurse practitioner if you want to change medications, if you want to increase or decrease the dose, or if you feel your medication isn't working. There's no one drug cures all. That's why there are different brands. Some people need multiple medications, and that's okay. It's important that you take medication as directed, or otherwise you could end up in a hospital. Hospitalization can be implemented for a variety of reasons: failed suicide attempts, failure to take medication, and feelings of being unsafe toward others or yourself are some reasons. Hospitalization is not necessarily a bad thing. It is not a place where the criminally insane go. It is not all padded rooms and white jackets. It is not a place where cruel experiments are implemented. It is a safe environment that aims to teach you how to live with the mental illness. It can also give you tools to help control yourself and your emotions. Different hospitals have different rules, but in general, hospitals have structured classes aimed to teach you skills like grounding, radical acceptance, emotional control, and other things. In the hospital, you will get a doctor and a therapist assigned to you. Medication is normally prescribed in addition to other things like ECT. Some hospitals even have art therapy, meditation, aromatherapy, and/or group therapy as well. Being hospitalized allows you to focus on yourself and your emotions while limiting your environmental stress. You are surrounded by people who know what you're going through and are trained to help. Unfortunately, there is stigma attached to mental health issues, but the brain is just another organ that is susceptible to disease and change. 1 in 5 people in the United States lives with a mental illness, so chances are you know one of them. Some mentally ill individuals are fully functioning adults. Some mentally ill individuals can hold responsibilities and power over their lives without having to be hospitalized. Some mentally ill individuals do need to be hospitalized, and that's okay too. The important thing is to know your boundaries and not be afraid to ask for help. After all, we're only human.